Okay, this one first. After that, we will focus on this. Okay, hello. Hello everyone, we're at ICM 2025 in Istanbul and I'm with Melissa Kelly. Welcome.
Hi, thank you for having me.
Thank you so much. And could you please introduce yourself for our audience?
Yes, so I am an operating room nurse who works for Solventum, which is a medical device company out of the Twin Cities and out of the US. So as part of my work with Solventum, I'm now a medical liaison, so I interact with our healthcare providers.
So I want to ask you about the infection. Why does the infection matters for you or your company?
Well, it matters for me and my company because when I take care of patients, obviously you want them to go home healthier than you saw them come in. But our company is certainly very focused on solving problems that lead to surgical site infections and other kinds of infections, bloodstream and so forth. So we develop solutions for clinicians that address that very problem.
What's ICM mean to you?
ICM is it's such a movement in the orthopedic industry. It's clinicians and the top clinicians in the world coming together to talk about best practice and how to improve patient care.
You attended so many congress and meetings, of course, and that's why I wonder what's the difference of ICM.
I think the biggest difference is definitely the formatting. Most of your conferences, there's smaller meetings for select groups, but most of the attendees of the conference never see really what's going on behind the doors. This is really different because you're sitting there with them as they make guideline decisions to better practice.
As a final question, is there anything you want to say?
Yes, I just want to talk a little bit about our company because we are a little bit confusing to some people. We're formerly 3M Healthcare, which has been around for 70 plus years. We spun off about a year ago into Solventum, so we're solving with momentum is kind of how we like to say that. And we are actually just launching a new product. This is our I-band CHG product, so our surgeons have been very receptive and eager to see this. But yeah, we're just really excited to move forward and develop and continue solving problems for healthcare providers and their patients around the world.
Okay, thank you for your time.
Thank you for having me.
Thank you so much. My pleasure.